Okay, Chairman, we're now live.
Thanks very much. Good evening, everybody, and welcome to a virtual meeting of the Corporate Services, Commerce and Communities Policy Overview Committee here at the London Borough of Hillingdon. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, which is Hillingdon London. My name is Councillor Richard Mills and I'm Chairman of the meeting this evening. A key role of this committee is to monitor the performance of local public services within our remit and to hold in-depth reviews on topics of resident interest. We engage with a range of external witnesses in our activity, which can include community groups, residents and subject matter experts. Where we identify areas for change or improvement, we will make recommendations to the decision-making cabinet. For those of you present during the meeting and intending to speak, please note that you'll be filmed and any statements that you make will be recorded and will be made public. Before we start, some important housekeeping for everyone present. Please ensure that mobile phones around you are on silent. If you have a headset, ensure that the microphone is away from your mouth to avoid noise and interference. Please keep yourself muted when you are not speaking and then unmute yourself when you come to speak. It would work best if only one person speaks at a time, and I as chairman will call you to speak and allow you a supplementary question before moving to another member to enable everyone to have opportunity, and will then come back round if people have further points or questions they wish to make. Before we move on to the agenda fully, I would like to do a roll call of everyone present to confirm your attendance. So grateful if you can indicate that you are present when I say your name. Councillor Harangi.
Present, Chairman.
Councillor Bridges.
Good evening, Chairman. I'm present.
Councillor Brightman.
Good evening, Chairman. I'm present.
Councillor Deville, who I believe is on the phone.
Good evening, Chairman. I'm present.
Councillor Tubadar.
Good evening, Chairman. I'm present.
Thank you. Councillor Dillon.
Good evening, Chairman. I'm present.
Councillor Bliss.
Good evening. I'm present.
And Councillor Farley.
Good evening, Chairman. Present.
Thank you very much, everybody. And then can I also just please get the officers present to indicate that they are also here with us in the meeting. So firstly, Kevin Byrne, the Head of Health Integration and Voluntary Sector Partnerships.
Yes, good evening, Chairman. I'm here.
Thank you. Naveed Mohammed, the Service Manager for Business Performance.
Yes, Chair, I'm here.
Thank you. And Liz Penny from Democratic Services.
Yes, present, Chairman.
Thank you very much. In terms of meeting control, if any councillor should leave the meeting partway through for a period of time, for example, a lost connection, the meeting will continue unless we are not quorum, and quorum is 5 councillors. Details of business for today's agenda are shown underneath the broadcast, copies of which have also been made present to all of those in attendance. So we will now move to agenda item 1 of the agenda, which is apologies for absence.
No apologies this evening, Chairman.
Thank you. Agenda item 2 is any declarations of interest coming before us. In the absence of seeing any indications, I take it that there are no declarations. I see no indications, so thank you. Agenda item 3, minutes of the meeting held on the 3rd of February 2021. Anyone wish to indicate to comment on anything on those minutes? In the absence of which I don't see anything, so we'll take those as agreed. Thank you. Agenda item 4 is the exclusion of press and public. So all items before us tonight are part 1 items, so therefore they are held in public. Which brings us to agenda item 5, which is our major review topic, which has been the voluntary sector's response to the COVID-19 pandemic in Hillingdon. Hopefully members have had a chance to look through the report that has been put together so far and the review documentation that sets out what we were aiming to do at the outset of this. And I've also had shared in the last couple of days, I guess, some draft recommendations or topics for us to talk about in terms of looking to build something together as a committee. So I'd like to use that as a starting point. Hopefully people have read those. I know Democratic Services have circulated those. Otherwise, this is effectively one, like I say, this is where I think we should have as a starting point. Happy to take people's feedback on these, whether they think they're good, they're in line with what our witnesses have provided us with feedback on, and also in terms of would be suitable recommendations, or if people think they're way off the mark and we've misunderstood what we've been told over the number of sessions. So I'm happy to see if anyone has any comments on those. Okay, I don't see anybody indicating. So on that basis, I'm taking the committee are broadly happy with those. Councillor Dillon?
Yeah, I'm broadly happy with those. Any scope for advising or for the council to look at the support that we could give to those those who are younger than 16, especially following news reports this week and some studies that the children below 16 are really affected by mental health. I'm not sure if we can add anything in specifically for them, but it may be useful.
Yeah, I think that seems perfectly acceptable to me. I think effectively then that would, I say, pad out the final bullet point to make it specific, or to make a specific detailed inclusion around those under 16. I think that's a sensible approach to draw additional attention to that. So I think in order to take this forward, I think, and look to you, Liz, from Democratic Services to guide us slightly on this. I think if the committee are broadly in agreement with the recommendations or the draft proposals, we would then look to build these into the wider, fuller report. And I guess through yourself, myself, and Councillor Dillon as the opposition lead, we'd look to bring this together in a final report, potentially for the next meeting, if that's possible.
Yes, Chairman. So that is exactly the process. So if all the recommendations are agreed, obviously we've perhaps slightly changed the last one, just in accordance with Councillor Dillon's comments. Then I'll start working on the report and obviously clear that with yourself and with Councillor Dillon, hopefully in time for the next meeting.
Okay, good. That's a positive outcome. Thank you. Yeah, and we can certainly look to proceed there and have whatever conversations we need to have offline in advance of that to make sure that when we hopefully, if we can get it for the next meeting, we're then in a close position to agree this fully, and then look to get this taken to cabinet with our recommendations as a committee.
Yep, that's absolutely fine. Thank you. In terms of the review topics, I'm assuming that the next meeting we would be looking at potential topics and having a discussion around that in terms of what we will be reviewing next as a committee.
Yes, I think that's included within the work programme. I think that the next meeting we would look at possible topics as well. So I think you're right, and I think we'll probably cover that in the later agenda to draw members' attention to that, to consider what further items we may wish to look at in the next municipal year.
Okay, thank you, Chairman.
Okay, thank you. Just conscious before we move on, I just want to make sure that everyone feels they've had the opportunity to speak on this. No one wants to raise anything further. Okay, great. Thanks very much. And we'll take that as agreed, and we'll take those actions forward as discussed. Which then moves us on to agenda item 6, performance tracking and data. Naveed, thank you very much for the paper that you've put together on this. I'm happy to hand over to you to speak through it and highlight anything that you would like to in particular. And then I will open it up to members to ask any questions, either broadly or on specifics that they have a particular interest in or questions around.
Thank you, Chair. So I don't intend to go through the paper line by line. I'm hoping members have had a chance to review and read through. What I'll do is I'll just provide a headline overview of how performance and data is arranged in the council, and then how we use it to shape operational delivery and the strategic development of services. So just as an overview, members will know the council provides a plethora of services, over 700 to all our residents, 100,000 just over households that we have in the borough. And as part of this, we routinely gather a wide range of information, both about the clients and residents that are accessing our services, but also just wider information about the borough as a whole, its demographic, its profile, and then look to kind of see how that might change in the future. So it's not just about the here and the present, it's also about projecting over the next 5-10 years to see what the needs of our communities will be, whether that's in relation to school places, the delivery of adult social care, and so those are the sorts of things that we would routinely capture. So it is a quite a deep and wide-ranging area that my team has responsibility over. And so in terms of that, there is a variety of ways that we gather the data, make sense of the data, and how we provide an analytical service to our client teams, whether it's in children's or in adults or in housing, to make sure that they are best positioned to provide the services that our residents need and want. What I've done in this paper is I've kind of separated it into 3 parts. I've talked about what is tracked and reported, just an overview of that, what the kind of responsibility and the relationship between operational delivery and service planning. And as part of that, part 3, there are some appendices attached, which kind of just give you an idea of how information is used in a practical way. So it's not just an abstract discussion by me. And that kind of links to the development of the Joint Strategic Needs Assessment and projects such as the Troubled Families Programme. If members have any questions whilst I'm going through, please do interject, and I'm happy to take those. So as I said, the council provides over 700 services, and so in order for us to ensure that these services are delivered in the most effective and efficient way, it relies on us having a robust evidence-based and a data set that gives us an indication of who's accessing our services and what their needs are. And in table 1, I've just broken it down by our directorates and just given some examples of the sorts of things that we would routinely gather. So corporate services and resources, HR data, basically who is working for us, and what's the kind of demographic profile. We routinely gather information from the Office of National Statistics, and so a lot of that is firmly geared in the census, and the census is only 17 days away, and so in the next 6 months we'll have a fresh data set about what our borough looks like now and how that's changed from 2011, and that's really going to be valuable for us in order to kind of understand what the needs of our borough are and how that might have changed in the kind of intervening years. We also have access to data that's provided by the Greater London Authority, and this is this is very useful because the difference between this data and the ONS data is that it's more it's updated in a more regular fashion. So whereas headline statistics about who our population are is drawn from the census, things like our demographic profile, our profile in terms of who our black and minority ethnic communities are and what their composition is, the GLA provides some really useful insights into that, and that's more kind of recent and up to date. And so drawing on that is quite important for us. And then finally, things like labour market trends. There's a website called nomis.web, and that's a treasure trove of information about kind of claimant rates for social welfare, but also what sort of industries are prevalent, how many people are in managerial positions, how many people are in manual work, etc. And again, that's kind of useful to understand especially when you start to triangulate information to try to better understand the composition of our local communities and the needs of our communities. The other kind of directorates, finance, obviously headline information about council tax collection, business rates, etc. Planning, school places is a big one. We do that every year. It's a statutory return that we have to make to the Department for Education, and this is kind of understanding what the needs are for our school places. So how many kids we estimate to be living in the borough in need of a primary school place or a nursery school place or a secondary school place, both now and then looking sort of 10 years into the future. And that's something that we do every year. Around June time, we'll make a submission back to the Department for Education. I've mentioned the strategic needs assessments. So this is very topical because a lot of these are around public health, and just looking out, what is the prevalence, for instance, say, of people who are smoking in the borough, the people, so people who might be in unfortunate circumstances and subject to, say, substance misuse, the number of people who've got COPD, so chronic obstructive pulmonary disease, so breathing difficulties. And so these sorts of information and profiles are provided, and we send that back to our team in public health to make sure that the commissioning arrangements around supporting our residents who have these conditions is robust. We do another strategic needs assessment for our community safety team, and in fact we're just in the process of finalising that this year. And this again gives a high profile overview of the types of crime that we've got evident in the borough, and how that's changed over the last 12 months. We have a detail about our performance of our police service and tackling things like robberies or acquisitive crime, Class A drugs, etc. And again, this information is used by our community safety team to outline the action plan and the priorities for our Safer Communities Partnership over the next 12 months. And then things like school attainment. In the last 12 months, we haven't had this information because of the pandemic and the cancellation of exams. But prior to that, so we're talking 18, 19, we would have had information about how many kids are achieving 5 good grades at GCSE, how many of our kids are going to Russell Group universities, for instance, and then where are those gaps, which groups are falling behind. And we did a really good piece of work, really looking at white British boys, because I think that's one of our target groups. And this information, again, is provided to our school intervention team, and they work with individual schools to address some of these gaps where they're identified. And then things like library footfall, books issued, this will be common across a number of different areas, planning, the number of applications received, etc. So it is a broad range across every single service area in terms of things that we can look for. When it comes to adults and children, again, this is a high profile area, largely because of the element of safeguarding that's involved, both in respect of adults and of children. And so we've got dedicated analysts working on this, and it's the kind of sheer volume of work that comes our way across these two directorates, the adults and the children's directorates, is quite high. And again, this covers a breadth of issues, right from social care through to special educational needs, through to youth offending, through to supporting our our key worker teams and our participation teams when it comes to, say, NEET figures, so the number of our kids who are not in employment, education and training. We gather all these statistics, provide reports and pass those on to our services to make sure that they know what our residents need, where the gaps are, and how services need to respond to address those gaps. So the list I've provided above isn't exhaustive, and it gives you a good demonstration of the sorts of information that we gather, and just how broad that is in terms of its reach. And so it is, in terms of where and how this information is used, I've got some, and where the information is drawn from. Just that bullet point list on top of page 37 kind of gives you that information, because it's not all drawn from one access point or one portal. The benefit of kind of business performance is that we have access to a number of these portals to be able to draw that information together, make sense of that information, then pass it on. So community safety, we've got access to iQuanta, which is the Met's sort of data portal. For public health, we have information from PHE, which we've relied heavily on when it comes to, say, for instance, our response from COVID. But also information from our CCG partners and Department of Health. There are shared service arrangements in place as well. So, for instance, things like NEAT, we get that data through Ealing Council, who provide a shared service on behalf of the 6 West London boroughs. And so that information is kind of gathered by them and passed on to us, and then we can do some of the secondary analysis and pass it on to our teams. I've mentioned the ONS already, and then there will be time to time where we kind of triangulate information, and we will use that and we gather that information from our partners. So, say the public, the health service or the voluntary sector, etc., will do a piece of work, and then they can feed that to us, and then we will use it to supplement what we already have. So, in terms of what we do with all this information, there's kind of 2 ways in which we look at it. There's things that we can do, which is around providing insight, and I'll touch on that. But there is stuff around performance, and this is really important because this is where we are act as a challenge to our client services, but also make sure that we are able to understand whether there are gaps in service provision. And so the sorts of KPIs that we develop and we report on using all this information, there's things that we just count. So the number of children in care at the end of a quarter, the number of tea dances held over 60s, the number of households on our council's housing register. And that kind of really helps us understand the efficacy of service delivery over time. So if we know that our number of children in care is going up over subsequent quarters, obviously there's an issue there for our children's services to look at and understand, to see what's going on and what's driving the increase in the number of children that are entering the system and that are coming into our care. Similarly, if the number of households on the council's housing register goes up, it kind of indicates that there is something going out happening in the community which accounts for that, and it's important for us to kind of understand that. And these are early signs, because inevitably with these there's an eventual knock-on effect when it comes to finances, because the more children we have in our care, the more costs we incur. Similarly, the higher number of households that we've got on our housing register means that there'll be a knock-on effect in terms of the number of households in temporary accommodation, and that costs as well. So these are early indicators in order for us to understand whether there are issues abound and that we need to kind of get a handle on. There are metrics that we produce around just assessing the kind of how quickly we perform certain tasks, and this provides a really good insight into the health of the organisation. So things like percentage of social care assessments completed within timescale, void turnaround time. This kind of measures the efficacy or efficiency of our services and our officers to make sure that we're delivering these on time. And a number of these are actually linked to statutory timeframes. So these are really high risk. So for instance, if we're not completing the required number of initial child protection conferences within 15 days, it leaves vulnerable children at real risk, and therefore is something that we need to make sure we keep an eye on and advise our services where we're not doing what we should be doing within the statutory timeframe. And this is the sort of stuff that Ofsted will, when they come knocking on our door, will take a look at. This will be a key line of inquiry for them to make sure that when it comes to these sorts of things, making sure that we perform tasks within the statutory deadlines that are given to us, that we're doing that in the most efficient way. Similarly, days taken to process housing benefit change of circumstances. Obviously, our families that are vulnerable come to us because they need access to social welfare. If we're not turning around these applications in a meaningful and efficient time, it leaves those families more vulnerable, and therefore it's a duty on us to make sure we perform these in the most efficient way. And then finally, outcomes. So the information that we gather, we turn it around into outcome metrics. And this kind of gives an indication of how the services that we deliver are actually being received and how the quality of life for our residents is impacted by interventions that we take. So if our school improvement team is doing a good job and we're working with our schools and we're addressing those gaps that I described before, then we would inevitably see the percentage of children achieving 5 good passes grow over time. Similarly, the number of our kids who are attending Russell Group universities would grow over time. So this is, at its basis level, I suppose these are the key metrics that members will have an interest in, because this is what will be affecting your constituents and making sure that they receive the services that they need, and those services are delivered in the most effective way that helps these communities improve their life chances. And so these are high on our agenda in business performance and high on the agenda of our services that we support. So there was a question, I think, made about locally arranged KPIs and nationally mandated KPIs. And so we used to have what was called the national indicator set, but that went when the coalition government came in 2010. I think that was a Labour initiative that was abandoned. So since then, there's pretty much been a devolved arrangement. So local agencies, local authorities can determine the selection of metrics that are right for their area. There are some that are still statutory, things like planning services. We still have to report the number of planning applications, sort of minor and major, that we receive. We still have to report on things like waste levels and recycling levels. And then from a statutory perspective, there are things that we have to make sure we go back on to, say, communities, local government around housing, and then DFE and DOH around social care. But outside of that, it is really up to us. And our services, we work closely with our services to kind of understand what the nuances are in Hillingdon. And some of the examples I've listed here are things like the number of our youth offending intake from a Black and minority ethnic background. You know, for our youth services, that's something which is really important, because comparing us to some of our peers, we have a disproportionately higher number of BAME background individuals who enter the youth offending system. And so we need to understand why that is. Similarly, just taking community safety as an example, the number of fly tipping incidents is higher. Working with our police colleagues, one thing that they really wanted to focus on was the number of arson incidents that we had, which was higher in Hillingdon compared to some of our neighbours. So there will be occasions where we have selective metrics that are particular to Hillingdon that we choose to monitor and track. Does anybody have any questions before I move on?
Thank you very much, Naveed. I see Councillor Harangi indicated, so we'll go to you first and then followed by Councillor Brightman, please.
Can I just check you can hear me first? So clearly a lot of data is collected, which is great. So I've got three questions. My first one is, how much of the data would you say is actually being used to inform decisions and service planning rather than just reporting? So that's question number one. Question number two, the figure that's generally used is that 80% of the time that organizations is used to do data prep, data cleansing, getting your data ready, and 20% on analysis. What percentage ratio would you say your team spend doing that? And then the third question I had was about data mining. I think on the front page of the report, you mentioned that you do collect data on an Excel database and data mining. What data mining do you do? Do you have any predictive analytics? Do you build any models? And if so, how accurate would you say your models are?
So if I just take each question in turn. So the first question, so just remind me, I haven't got a notepad. I'm not writing these down. I do apologise.
Was about how much of the data would you say is being used to inform decisions and service planning rather than just reporting on it?
So the information if I was to be entirely honest, it's a mixed bag. So the information is some departments who are very operationally driven will use the information on a regular basis. We provide, so for instance, just taking the statutory services like children's and adults, we provide weekly information about caseloads, about assessments that are not completed on time, and that's really granular information about this particular social worker has got these cases and these assessments are outstanding, and so that's used regularly to make sure performance appraisal for those social workers is managed effectively, that we can redeploy resources where we've got a backlog of assessments that need to be completed. So there's a regular use of that information. So operationally, I think we're very good at doing it. Strategically, I think there might be some gaps in terms of making sure that the information that's provided is used robustly and effectively for instance, say the commissioning of services. And I think sometimes, but Hillingdon is no different from other organisations in that respect. So I think there is certainly room for improvement when it comes to the strategic use, but operationally, I think we do very well. And strategically, there are some good examples. So our community safety team, they use that information to really target what our residents say is a priority for their area. So we gather what's called ward priorities, and we liaise with a broad range of people to understand what these priorities are, from our community wardens team to our kind of the Met Police and also residents groups. And those kind of the things that are fed back to us in terms of priorities, action is taken to address some of those, and that's kind of really strategic in nature. So it is a mixed bag.
Thanks for that. Number two was the 80-20.
Yeah, I'd say we're probably about similar. We have a real challenge for the council is around data quality, because as a corporate team, we have access to the case management systems that are used across a wide range of services. But when we look at those and when we extract the data, we don't know whether little Johnny is 9 years old and is attending this school, because we rely on that information to be accurate at the point of entry. And if it isn't accurate at the point of entry, it poses a problem for us. And so there is work that we have to do to reconcile information to make sure that it's consistent with what other systems are showing, because systems don't often talk to each other. And a really good example here is our finance system and our performance data. There's always a degree of disalignment between the two. And every year we have to go through an exercise of cleansing that information, reconciling it to make sure it's accurate. And we recognise that as an issue. One of the things that we have put in a business case for, and there's work that's going on at the moment, is getting more effective tools like Power BI or Tableau, because we are, I think, slightly behind the curve when it comes to some of our peers. And what that would allow us to do is devote more time to the analytics, which I think is where the value is, and less time to the preparation, which I think is, if we get it right first time, it would make everybody's life easier. Sorry, Councillor, you're on mute.
Sorry, my last question was on data mining. So, because you mentioned at the beginning that you do some data mining, so what type and any predictive models, etc.
So a good example of where we do some predictive analytics within the council is around the school places forecasting, because that's very much linked to understanding what our need is going to be in 5 years and 6 years time, especially when the kind of large capital investments are possibly linked to that. So if we need to build a new school, we need to be able to understand what the need is. And we've got a very good model, in fact, when it comes to our school places planning. We usually are within sort of 2 to 4% accuracy when it comes to understanding, in this particular planning area, we're going to need X number of places. And we do very well when it comes to understanding that. Some of the other areas, I think a really good example is around where we can utilize partnerships. So the work we're doing around COVID, for instance, at the moment, it's all about trying to understand how this the spread of COVID is going to be affecting us, how the particular milestones, for instance, the school opening on the 8th of March is going to affect the trajectory of COVID spread. And we've partnered with Brunel University because they're very good at modelling. They've got a whole unit within their kind of IT team or their computer science faculty that's devoted to this. So it's about utilising some of those partnerships where we don't have the expertise around data mining or the tools in order for us to do that. So it's about making sure that we've got the partnerships in place to do that, and we're doing that with Brunel.
Thank you.
Thank you very much. Councillor Brightman.
Thank you, Chairman. Naveed, do you know why the surrounding boroughs have lower rates than Hillingdon for crimes such as arson? Does any of your data give you that detail?
Unfortunately not. So not simply drawing on the data that we have at our disposal. Where we've got questions like this, so if our head of community safety wants to understand benchmarking and how we compare, we can do that analysis, and then we can talk to our neighbours to understand what things they may be doing differently that would help assist us in terms of further action planning. But that work often goes back to the services in terms of kind of the actual what are they going to use that data for. We can certainly assist in the research though, and that's where my team would come in. So doing that benchmark analysis, looking at best practice elsewhere, looking at what's worked and what hasn't worked, we can draw some of that information together and then pass it on. But we aren't routinely able to tell with just the numbers about what particular tactics may be working in some of our neighbouring boroughs that could be applied here. That requires a conversation and a discussion with our neighbouring boroughs.
Thank you. Do ward councillors routinely get furnished with the data relating to their residents, or is it something we have to specifically request?
So this is information that you would request. We don't routinely publish. We publish. So, for instance, if you go on our website, there's something called Ward Profiles. So that will give you an overview of the ward, its demographic profile, its particular need, etc. But these are snapshots in time. So we would do these, for instance, for say 1920, and then they won't be updated for the year. So if you want something which is, Naveed, what was this number like last month? That would be a specific piece of work that we would do. So you could request that directly from us.
Thank you.
Thanks very much. Councillor Farley.
Thank you, Chairman. I'd like to ask a couple of questions. First of all, one to do with, you mentioned sort of major projects and buildings and homes. I was wondering whether the council is collecting information that informs those major bills in relation to GP surgeries, GP requirements that might be needed to inform the application. That might be, so we've got lots of bills all over the borough. I'm wondering if that sort of data is collected, and if it's how it's shared, and if it's shared with that to inform a major build. And also mentioning the census, some areas, some communities have got transient populations, and also different types of housing arrangements, housing needs. So the census data becomes out of date the longer you go on. And I'm wondering, in relation to sort of the needs that we've got for transient populations, and also with the traveller Roma communities, and how we get data for that to provide needs for those as well. Thank you, Chair.
Okay, so just touching on the first question, which was how we use information to inform major bills for instance, like GP surgeries. When it comes to the health sector and the provision of GP surgeries, that's not the council's remit. So it would be the CCG that looks at that information and then make sure that our communities have access to the facilities in a convenient way. One thing we do have responsibility for, though, is making sure community pharmacies, there is a provision of community pharmacies and they are located in the most effective way. And we do something called a pharmaceutical needs assessment. We do that every 2 years. It was due last year, but it was postponed because of COVID. But this is a statutory assessment that we do. And so we have had no update from DOH until now, but it's something that we would be planning right now to do that. And that looks at kind of liaising with our local local pharmacy committee, the LPC, to understand what services are provided, where those are provided. So obviously some community pharmacies provide a plethora of services, not just the dispensation of medicine. They provide smoking services, the provision of I'm not quite sure the technical term, but people who are on methadone, for instance. And so that's the sort of information that we would gather. We would plot that against where the need is in the borough. And if we see gaps, because there should be a pharmacy within 3 miles that's accessible to our residents, and where there are gaps, then we would inform the CCG and our health colleagues that this particular community may be not accessing pharmacies in the way that they need. But that's so the actual provision of that, though, is not something the council influences. That would be the CCG to influence and shape. What was the second question? Sorry, Councillor.
Thank you. I mean, I was sort of looking how. I understand, obviously, it's not a council service, but it's an external service. It was more the linkage between informing. You got a new build of a lot of properties and so on. It's how that necessarily informs the decision to go forward with it. So if you're building a certain area and there's actually no GP service in the locality, it was how that information was necessarily gathered to inform decision making to go forward with such a development, whether or not it's part of the planning thing that you can sort of go forward or not with it. But it was informing that process. The other question was to do with transient populations and the Roma traveller community.
So we gather information about the one thing about the census is that, as you rightly say, it's a snapshot in time done 10 years ago, and things quickly change. And we don't know, whether the X number of people from a certain background are still the same, 2 years later. And things like Brexit, things like the pandemic can change things very quickly in terms of our local population profile. So that's where we rely on things from the GLA, the Greater London Authority, because they do something which is more routine. So it's not, the last update I think they did was 2019. So we've got something which is relatively more recent, not completely recent. The other thing that we are able to do and supplement, for instance, is we track the number of HMOs that, so it's a legal requirement to register an HMO, and we have a register that's maintained in our housing team, but which we have access to, and we use that to inform some of the work that we do. So a good example here is around COVID. We get information about individual cases at postcode level, and one thing that we do is routinely map that back to where our HMOs are, to understand whether the COVID rates or these COVID cases are linked to specific HMOs. And so we're able to kind of do that analysis because it's information that we hold within our housing services team, but which we have access to corporately. When it comes to things like, or communities like the traveller community, so here we really rely on information that might be gathered within our schools population, because the one thing that we're able to access there is we do 3 censuses every year. We do one in January, one in the summer, and then one in October. And this gives you an accurate profile of who our pupils are, which communities they're drawing from, which languages are spoken. And we can use these as proxy indicators to try to understand who our communities are and what community and background they're from. and we can use that to inform service planning and service delivery within some of our areas.
Thank you very much.
So, okay, Councillor, did you want to come back with anything?
That's all for now. Thank you.
Okay, thank you. Councillor Dillon, please.
Thank you, Mr. Chairman. Hi, Naveed. Information regarding homeless people, how is that gathered at the moment?
So it depends on which definition we're using for homelessness. If it's rough sleeping, there is an exercise that is done. I'm not sure the frequency because it's picked up by our housing colleagues, and officers and volunteers go out during the course of a night and literally count the number of people that are on our streets who don't have a roof over their head, and that count effectively is done, and it provides an indication of the prevalence of rough sleeping, particularly. What we do also count, though, there's a legal definition for homelessness, which is if you are and I can't quote it to you. I would be making it up if I tried. But that legal or statutory definition is used to count the number of people who approach us in housing need. So if you have a family that comes in that meets a certain criteria, we count them as homeless, and then they would be eligible for housing assistance either through private sector or through social housing. So it depends on the definition that we use in terms of how we count homelessness.
Thank you. I have another question, but that one also brings about another question. I'm sure it'll bring about many questions. And it's probably all to do with, both questions to do with the quality of the information that you're gathering. You've just given us an example there where, and I know the guys who count the homeless people do it once a year. Do you go back and they do it once a year at a specific date, and that's it? Doesn't matter how cold it is or warm it is, it's all done. You don't know how good that information is. Do you then feed back to them and say, look, it's only one day, we don't know if you can't make an assessment and build a picture out of a day out of 365 when there's 365 of them. That's not great information. So in essence, what can we as a council do to make sure, or an organisation to make sure that instances where you have that's pretty poor quality information, I would say. What can we do to improve that?
So I can't answer for that specific example because my understanding is, and I will go back and I will double check and come back to committee through the clerk. But that's a standard approach that all local authorities use. So that kind of one night of going out and checking. I'm a resident in Slough, and my sister volunteers to do that exercise every year. And so I know in Slough they use a similar sort of methodology for counting. I suppose in terms of where we've got just a wider point around where we've got poor information, how do we assess or better improve our understanding of that? And this is around using some of the triangulation that I described earlier on. So if we know that, we are, so just take as an example, the information to try to understand our Eastern European community. And I was doing a piece of work earlier on today, looking at the take-up of COVID vaccinations within our particular wards. And unsurprisingly, in some of our wards, white other, which tends to be Eastern European, was higher. Also, it was lower in terms of vaccine take-up. And so in order to kind of understand where these communities are, we can utilize things like mapping, utilize things like the mosaic, utilize things like our school population profile to kind of understand where these communities are drawn from and kind of and triangulate that data to get a better picture. So it's really about using a broader range of sources of information that we've got access to enrich the picture that we have and supplement it. So it's and that applies to a number of different areas, so whether it's if we're doing a piece of work around looking at the need in our the attainment levels of our white British boys, for instance, we don't just look at their attainment level. We can break that down by the kind of deprivation, which areas the communities are from, and look at the LSOA, so lower super output area, breaks a ward down to 6 neighbourhoods. We can really hone in on where these communities are and what the deprivation profile of those communities are. We can get access to school information about supplementary support that those children might be receiving. So that helps build a picture. And it's effectively called layering. So we start off with one particular piece of information, and then we layer it with other information that we've got access to help provide that, to help build that picture about need in that particular community.
Councillor Dillon, I don't know if you had something else. Just before you do, if you do, I just wanted to say that in terms of the rough sleeper analysis, I am sure that at some point as a ward councillor, I was written to by someone within the council who was undertaking a review to wonder if I knew of anybody or anywhere, any individual in my ward that was rough sleeping. So I think there was some attempt to use, if we call it local knowledge, if any councillors hopefully have an insight into their ward or would be aware of people in these situations. I think that was used at some point, but I don't know what the frequency of that was. So I wouldn't say it was annually, but that was just for information. But Councillor Dillon, I know you had something further you wanted to ask.
No. Thank you, Chairman. It was how Naveed had finished the previous response. I had a question on homeless people, and the two sort of I brought together because it was interesting the way it's about quality of information, and that's what I was trying to ascertain. And they both just kind of involve each other. The only other one is our councillor MEs. How do you use those in order to the data, and are you able to bring patterns and the kind of stuff that we're doing, and then give that to your colleague?
So we certainly just very recently the complaints and ME service has actually moved into my team, and so I have responsibility for that. We routinely use information around complaints, and we feed that back in terms of lessons learnt, and things that we can go back to services to say, we're getting a plethora of complaints from this particular issue. There needs to be more done about it. Similarly, for member inquiries, a piece of work we did middle of last year was around fly tipping. The number of ME inquiries that we've got around fly tipping, and the number of cases that were opened kind of prompted us to do some work with our ASBIT team to improve the way in which we deal and handle fly tipping inquiries. So yes, absolutely, that information is used to inform service action.
Thank you. Councillor Harangi, you indicated again?
I did. I'll ask them one by one. I've got a few more. You mentioned that you use, or the team use, a case management system. Is that a tool for inputting data, or does it provide analysis, visualizations, graphs? And is that something that only your team can get access to, or can the service areas also make use of that?
So the case management systems are systems that are owned by the service and are used by frontline staff to input the data. So Liquid Logic is the system that we use for our social care teams, and it will be social workers who have access to that. So, excuse me, every time they do a visit and they're doing their write-up, they would write up into that case management system. What we have is we have something called Business Objects, which is a tool that links to those case management systems that allows us to extract the data in a summary fashion. And then we would use things like Excel to interrogate that information and provide the visualizations.
Got it. Okay, thank you. Second one was, again, you mentioned the use of Excel. How is that managed, I guess, to ensure data governance? And also, if someone needs to access that Excel document, how from a different service area, how does that work with the use of Excel?
So we have to be very careful around version control. And the thing with Excel is that if you have too many people accessing the same document, it leaves us vulnerable for us to lose track of changes that are made. So we do try and police that really well. So historically, what we've done is we've had shared drives, we've had shared areas where predominantly managers can access the information in the most efficient way. So our weekly report that goes out to, say, the Children's Services Management Team is huge, and so we couldn't send it by email given its size. So that's in a shared area that Julie Kelly, our director, Alex Coleman, the AD, they have access to, so they can access that information and understand, or get answers for the questions they have. One thing that we've obviously as a council moved over to is Office 365, and that makes it much more easier to then have multiple people working on a document, but also manage version control so much easier. And so that's still obviously in its early days. We only moved over in September, October, and there's a lot of work that still needs to be done. But that certainly makes sharing of information easier than certainly. We had Google Sheets before, but it wasn't an efficient tool as Excel is. So yeah, it wasn't used as much.
Okay, thank you. And so obviously lots of data is collected, and I know you went through it by the different directorates. When you're doing your analysis, do you use data from one area to enrich your analysis of another? To
yes.
build a bigger picture.
Yeah. So and that's done routinely, and it's not just other areas. And I'll give you a good example here. So we did the Troubled Families program, and it's one of the appendices. We have to draw on information across a very broad range of services, because the qualifying criteria for troubled families touches on a number of different services. So for instance, in children's, it could be whether the child is in care, but another qualifying criteria is parents who might be subject to antisocial behaviour controls, and that information is going to be within our community safety team. We'll have truanting information that's in our education team. So we look at a broad range of areas to supplement and draw on to get to kind of build that profile. And that routinely applies to the analysis that we produce as well.
Excellent. I've got one more, and then I'm picking up on something Councillor Dillon mentioned about MEs, and you said that you've started to look at MEs and complaints. How do you do that analysis? Is it structured, as in is it text analysis that you do, or is it just mainly looking at this complaint is about this complaint is about that, or are you actually analysing the text?
It's not a textual analysis, so we don't use SPSS, for instance, to kind of do some of that analysis. What we do try to do is provide, there are within our contact centre, where most of the information is that first kind of call is logged, there are categories that we have, and so MEs are coded against a particular category, and then we can provide a summary analysis of those categories. So we can say, X percentage of MEs were for housing, and within housing they were for repairs, or X number of complaints were for in the community safety team, so in the ASBIT team, and they were for fly tipping. So some of that aggregating, we can aggregate that up and then provide some of that analysis. So yeah, unfortunately we don't do textual.
Got it. Thank you. That's me done. Thank you.
Okay, thanks very much. Just looking around, I don't see anyone else indicating, but I'll give a final opportunity. No? Otherwise, thanks very much, Naveed. I think it was very useful. Again, something that was a new request from us with a brief bit of background internally on. I think it was a very useful information gathering exercise, and something we've learned a lot more on and understand more around how the council is using data. So thank you for your time this evening.
Very welcome. Thank you very much.
Okay, so that takes us on to agenda item 7, which is the forward plan. Does anyone have any comments or questions on any items before us in that? No, I don't see anybody, so happy to note that, which takes us to agenda item 8, which is our work programme. Just Just opening this up in front of me. So our next meeting is on the 6th of April, which is the day after Easter Monday, I believe. As discussed earlier on our major review, we'll be hopefully looking to bring the final report, maybe in a draft format, to that meeting. I'm not sure whether we'll get a chance for members to have that in advance of that, but certainly we can look to see if we can do something around that. In addition to that, we have items scheduled on carbon reduction, which is something this committee looked at as a larger review a number of years ago, as well as the prevent item, the prevent strategy, which is, I guess, comes under the community engagement piece within our remit. We also have scheduled a past review of the homophobic, biphobic and transphobic bullying review that this committee undertook probably 2 to 3 years ago, I think. So we will, between now and then, we will follow that up with officers who were leading on that to understand how that has progressed, and hopefully they'll be able to come to that meeting to present how the recommendations that were agreed by Cabinet have been implemented and what hopefully successes and steps have been achieved since we made those recommendations. And then I guess the other one, which isn't on the work programme, but as mentioned, future review topics, given that we are working towards the final report of the major review now, it'd be useful if members have consideration for any future review topics that they would like to bring to the committee. And again, I'd refer you to the terms and conditions at the front of the agenda pack, which outlines what is within our remit. I know sometimes there's an element of crossover between different POCs, but if people have ideas, then they are, of course, welcome to share those. Anyone have any comments on the work programme? No, thank you very much. Happy to note that then. And that actually brings us to a close. That's the end of the agenda. Thank you very much for your time, everyone, this evening. If you can remain online and on mute until the YouTube stream is finished. Otherwise, thank you and good evening.
Thank you, Chairman. Just bear with me while I finish the stream.